We're
Hello.
ready? It's me. Oh,
You're live.
okay.
Good
I
evening.
want to welcome everyone to Malice in Memphis. I'm the vice president. I'm afraid that our new president is down sick with COVID and is just too sick to preside. So I'm, as vice president, I'm going to step in, and it's wonderful to be here. I want everybody to kind of introduce yourself so that our speaker knows who and what she's talking to. Let's start down with Angeline.
Morning, everybody. Good morning, Dr. Curry. Glad you're here.
Thank you. Good morning to you.
I'm Angeline Sherrod. I write primarily mysteries, romantic suspense, working on my first urban fantasy.
Okay, Victoria, you got to unmute. Oh, I know she went away for a minute. Richard, why don't you start?
Okay, I'm Richard Powell. I write mostly mystery, suspense, historical fiction, science fiction. Just released a book in the Jurgen County series, Witch Dance, which I'm really kind of tickled with. It seems to be doing pretty well. Has anybody else besides me seen Angela's video on? Scared the heck out of me. I was about ready to call you halfway through and tell you better call the cops. You know, there's something wrong there. That was so cool.
That seems to have been the general response.
No, my response was, where's she got a man? That's what I would want to.
Well, we don't talk about everything, you know, right?
Exactly.
I mean, you know, some people don't
Right.
share everything on Facebook, you know.
All right, Elliot, introduce yourself.
Hi, everybody. I'm Elliot Parker. I write mostly mysteries and thrillers, and I have a collection of short stories that came out right when the pandemic started. And my latest book, called A Final Call, was released in November. So glad to be here, and thank you, Dr. Curry, for joining us.
All right, Jim.
My name's Jim Pavela. I've written a series of police procedurals and have a series of mystery, paranormal 8th grade books.
Okay, Pat.
I've written about 70 books, I think, over the years, and including suspense, historicals, cozies, a little bit of everything. And right now I'm working on a couple of suspense. So
Good. Christo.
I'm Christo Nell. I will call myself a wannabe writer because I'm still learning in that process. I've got one novel mystery and one short story in the Malice anthology published. I just submitted another short story, and we'll see where it goes.
Okay, Barbara.
I am published in Paranormal Time Travel, and I have short stories in all of the anthologies.
Okay, Lynn, you want to?
I'm Lynn Naples, and I've written a cozy mystery and trying to turn that into a series. I've got a series of short stories that show up in the anthology that are Andrews and Jeffers Detectives that are here in Memphis. And then I have been published in a few other anthologies outside of Malice in Memphis, and have done period pieces that are historical.
Okay, Victoria, are you there? No, I know she said she had to go away for a minute. I'm going to skip you, Siri, because I know she knows who you are. But I want to introduce myself. I'm Jackie Flom. I'm the vice president of Malice. I have a novel, historical suspense, and a novella, and several short stories that are published outside the, and I just sold a story to Black Cat Mystery. which apparently is not going to be published for a year, but I'm getting a contract, so I'm pretty sure it's out. They're going to do something with it. And also I had a short story accepted for Low Down Dirty Vote 3, which I'm very excited about. So as I was saying earlier to Dr. Curry, I'm always have to stop and do a lot of research and thinking when I'm introducing anything that has to do with forensics. So that's why I'm very happy to see her here. All right, Sarah, you want to start off now?
Oh, absolutely.
Introduce yourself and then introduce her.
Right. I'm Sri Shankar. I'm a radiologist. And I have a collection of short stories published. I have a few published in magazines like Conclave and one other. And I have two stories in the anthologies that the Malus puts out. Don't get that much time to write lately because I've gotten very busy with work, but hoping this year is an improvement. Anyhow, let me now present our speaker for today, and Erica Curry. Thank you very much for agreeing to do this for us. Erica has been in the, I don't know what they call it, the coroner's office or the forensic department of UT Health Science Center. It's kind of separate building. It's a pretty state-of-the-art facility the few times I've visited, which is separate from the rest of the medical school, the hospitals, and everything. It's a standalone building. Correct me if I'm wrong.
Really?
Oh yeah. It's a little bit. It's in downtown, sort of, but it's on a different location. You could walk there, but it's a long walk. Anyhow, Dr. Curry went to medical school at UT, right here in Memphis, and did her residency. Actually, she did a year of residency in anesthesiology. So any intubation misadventures or resuscitation misadventures, you can ask her about. After that, she switched tracks and went into anatomic and clinical pathology. She did a forensic pathology fellowship at Miami-Dade County Medical Examiner's Office. So, CSI Miami, so that's great. She's published several papers and posters and research presentations. And I'm not going to take up too much time anymore. I'm just going to let her at it. So Erica, take it away, please.
So hello, everyone. I want to say thank you to Sri and the group for inviting me and allowing me to speak. In addition to what he said, I was born and raised in Memphis. So I went to Central. That's always the question in Memphis, which school you could go to. So I went to Central and then I did the training, most of my training away, and then I came back and I've been back in the city for 9.5 years. And I'll kind of get into the logistics. Already a question asked about the Memphis office, as Sri alluded to, being different and separate and all this. So hopefully my presentation, can somebody allow me to share my screen?
Lynn left.
Oh, I should have asked him before.
I'm
Yeah.
here. I'm just eating. I didn't want anyone to see me. You should be able to share your screen now.
Okay. So can you see my presentation?
Yes.
Yep.
Make sure. A little technical difficulty.
There you go.
Can you, hold on, it won't let me advance.
I like the title already.
It was fine. I could see everything. What happened?
It wouldn't let me advance it, so I'm trying to.
Oh, okay. Well, the nerve.
Okay, can you see now?
Yes.
Okay, great.
Yes, we're good.
Okay.
Yeah.
So, name of the talk, I thought it was try to be clever sometime. Forensic pathology, fact versus fiction. So popular forensic TV shows, I put on the left the ones that are supposedly mostly fiction. So CSI, NCIS, Dexter. On the right, more they're supposed to be based on nonfiction. But in my opinion, they introduce some fiction almost every time. Hopefully you've heard of at least some of these. So the shows that the forensic pathologists that I know we watch, Autopsy Last Hour. I don't know if you guys have heard of that one. There's actually a forensic pathologist there that has reviewed medical records, the autopsy report, and actually gives credible opinions and thoughts, and it's pretty thought-provoking to me. The other one is Dr. G is no longer on, but it used to be on. She was the chief medical examiner in Orlando, so she would always present information, obviously credible, real information with real life opinions and findings. And then on Netflix, it was a recent series that happened right at the start of the pandemic called The Innocence Files. And that's really interesting because it talks about a little bit, I don't know if you guys have heard, Mississippi has a troubled forensic past, and it kind of delves into that a little bit, in particular with the forensic pathologist that was there and the forensic odontologist that was there, and bite marks and all of this stuff. So I've watched all three of these. They're very realistic. I don't, at the other shows I gawk, I can't even watch them because I'm like, oh no, this is just too, no. So forensics books, obviously Patricia Cromwell is probably the most known amongst us as forensic pathologist. She actually donated money to have a crime scene investigation setting at the Baltimore, Maryland medical examiner's office. Is really cool. Has a complete kitchen set up and everything. I don't know if it was in exchange for information or whatever, but she did donate. Kate Weiss, The Secrets You Keep, Kelly Rimmer's The Things We Cannot Say, James Patterson's Private, and Jonathan Kellerman's Crime. I haven't read all of these. I've read a couple of Patricia Cromwell's books, but once again, they're always a little bit off. These are a forensics book that one is I've read, and the other one is recommended on the left, Working Stiff by Judy Melinek. She's actually an actual forensic pathologist, and TJ Mitchell is her husband. She trained at the New York Medical Examiner's Office, so most of her writing is about the time there, and she actually discusses the work and the feelings of pathologists, what they go through, how the scenes are investigated. So it's a really quick and easy read. And then recommended is All That Remains, written by Sue Black, who is a forensic scientist. And forensic scientists kind of criminalistic work, crime scene investigation is kind of her main area. So first, I'll try to discuss, like I said, fact versus fiction misconceptions. So coroner versus medical examiners. Most people think they are exchangeable or interchangeable. To the lay people, they are, but to us as forensic pathologists in the community, they're completely separate entities. So all medical examiners can be coroners, but most coroners cannot be medical examiners. But both of our overall goal is to determine the cause of death and the manner of death and to fill out death certificates. So coroner system actually originated in England in the 11th century, and then it was established in 1600s in the United States. Most
Sorry, can I
coroner,
ask a question?
sure,
So medical examiners are MDs, but coroners aren't.
that's correct. And I was
Okay.
just going direct.
Okay.
So most don't have any training in medicine, let alone forensic pathology. In some states, your only requirement is that you be 18 and have a high school diploma. And often they're elected or appointed by a mayor or some other political figures. Sometimes sheriffs are coroners, which is an obvious conflict of interest, and because the person doing the investigating is the person that is determining the cause of manner of death and signing a death certificate. And they do utilize medical examiners for autopsies, but it's under their discretion whether they want to do that or not. So medical examiner or forensic pathologist, these are two interchangeable words, literally. Medical examiner system was established in 1877. You must be a physician to be a medical examiner or a forensic pathologist. So you have to go to MD or DO school. Then you must have 4 years of training in pathology, and then 1 year of training in forensic pathology, and you receive board certification. So you can work for a private company, which is rare, but they do exist. County government, so local county government, state government, which is I'm a University of Tennessee employee, or you can be self-employed and start your own business, do private autopsies, what we call them. People actually sign contracts and do private autopsies for people in the community all the time. So those are the different types of jobs you can have. So the coroner versus medical examiner system. So 22 states in the United States are completely medical examiner systems. In Tennessee, we're a complete medical examiner system with a caveat, meaning that all the medical examiners are doctors, physicians, MDs or DOs. There are 5 in Tennessee forensic centers. We like to call them regional forensic centers. So here it's called the West Tennessee Regional Forensic Center or the Shelby County Medical Examiner's Office. Those are 2 interchangeable terms. In Nashville, it's the Nashville Medical Examiner's Office, which is run by a private company. Let me go back to here. We used to be, back in the day, historical context, at a ear, nose, and throat old surgery building off of Madison across from the Firestone. It was an old, decrepit, horrible building. I actually came to interview in that building and said, they told me they were building a new building, and that's the only reason why I came to work here, because the building was that terrible. It was kind of more close to the UT campus district, and they were University of Tennessee employees for a long period of time. And then a controversy happened with the chief medical examiner. And so the county wanted to have a different managing system at that time. So then they went with a private company for several years, and then they switched back to be University of Tennessee. So how it works in Memphis is that Shelby County contracts with the University of Tennessee for the management of the office. So basically Shelby County pays University of Tennessee to manage all of the personnel, operations, everything that ultimately goes on in the office. So that's how we became to be University of Tennessee employees. So like I said, there's a regional center in Nashville, which is run by a private company. So once again, the Davidson County contracts with the private company to run the management of the people in the office. Chattanooga, which is a local county government forensic center. There's Knoxville has a regional center, and I believe they are now local government employees. They used to be the University of Tennessee and Knoxville government employees, but that changed in the recent years. And then East Tennessee has their own regional forensic center. So in the counties in between, there is a physician that is the medical examiner, but he is, most of the time he or she is a family doctor, a internal medicine doctor. Those are probably the most, and they volunteer for the role. Then not any of them aren't elected, and they usually get appointed by whoever the mayor or any, I guess, whoever they're under their system that they run. So that's the way it works in Tennessee. 15 states have completely coroner system. Mississippi is completely coroner system. And 13 states have a mixed coroner and medical examiner system. And Arkansas is a mixed coroner medical examiner system. So why don't all states have medical examiner systems? Obviously, you'll have an actual physician doing the death investigation. If you had a medical examiner system, you would have pretty much accurate results with autopsy, equal across the board scene investigations, but there are a shortage of forensic pathologists. There are only 600 to 700 of us in the whole country, and funding. Each jurisdiction has their own funding based on budgetary restraints by the county, and so it's hard to actually have equal, like the small counties in West Tennessee that we service, they only have a certain amount of money that they can spend on autopsies. So therefore they are restricted by the number of autopsies that they can actually send to be performed. So in our office, we service Shelby County and 13 counties in West Tennessee. There are 7 board certified forensic pathologists. At our office, we train 1 to 2 forensic pathology fellows, meaning people that are already pathologists but are looking to become a forensic pathologist. So you have to train for a year. We employ 10 forensic technicians, which help us complete the autopsies and do all the ancillary things that we have to do related to the autopsy. We have 11 scene investigators, meaning they go out to the death scenes. And then we have 5 administrative staff, which take all our phone calls, make autopsy report copies for families, for the DA's office. They do billing and different things of that nature. And then 2021, we actually performed 17,000, I'm sorry, not 17,000, it feels like that, but 1,732 autopsies, which when I first came here almost 10 years ago, we were averaging about 1,000 autopsies a year. So the types of deaths examined. So not everybody that dies in Shelby County comes to the medical examiner's office. That's a misconception as well. We would be inundated and we don't have enough staff nor enough of the necessary funding to do that. So sudden unexplained deaths, so meaning people that were healthy to most people's knowledge, had no underlying medical conditions, and they die suddenly. Suspicious deaths, natural unattended death, meaning people that have natural disease, hypertension, coronary artery disease, COPD, and they haven't been seeing a doctor regularly. So they have no physician that they saw that was managing their diagnoses. Homicides, suicides, overdoses, traffic accidents, falls, sudden infant deaths, deaths in custody. These are just major categories that people think. Obviously we do some more categories, but these are the major ones that people think of. There's a Tennessee Postmortem Act that gives us legal rights to perform autopsies deemed under these categories, but there is an exception. There are certain religious exceptions they have, and even if the family just adamantly opposes, there are legal interventions that can happen where they can go before a judge and have the case heard, and the judge can say, well, you don't need to perform an autopsy in this case, or you don't have to perform an autopsy in this case. It rarely happens, but I mean, there is occasionally where it happens. So the responsibilities of a forensic pathologist to perform an autopsy, obviously, we collect evidence and toxicology samples. We take pictures and we do paper documentation, ultimately in an autopsy report. We do microscopy, or looking underneath the microscope of organs. We interpret radiologies, which is how I got to know Shri. We interpret toxicology, we review medical records, we examine clothing when necessary, we obtain consults from different dentists or anthropologists or, other pathologists, trauma surgeons when we need. We determine the cause and manner of death. As I said before, we produce autopsy report and we actually do court testimony. So the cause of death, this is another misnomer, misconception amongst the lay public. So it is the disease or injury or process that produces the physiological disruption inside the body, resulting in death. So causes of death are basically the examples of them are gunshot wound of chest, blunt trauma, atherosclerotic cardiovascular disease, or also known as coronary artery disease, fentanyl intoxication. So the common causes of death that you'll probably hear people on the news say all the time is cardiopulmonary arrest. That is not a cause of death. That is the definition of death, that your heart stops and you stop breathing. So that cardiac arrest is not a cause of death. So the mechanism of death is actually the physiological derangement that results in death. So like I said, gunshot wound of the chest is the cause of death. The mechanism of death is a sanguination or bleeding out. So that also is not the cause of death. So you shouldn't put that, we don't put that on a death certificate. We don't say it's sanguination. If we say that, we say due to a gunshot wound of the chest. So cardiac arrhythmia is the mechanism of death. If they had a heart attack because they have coronary artery disease and it led to a cardiac arrhythmia. So acute myocardial infarction, once again, is a mechanism of death, is often due to having coronary artery disease. And CNS and respiratory depression is the mechanism of death often in overdose deaths, so fentanyl intoxication. So those are the two misnomers that are out there that, like I said, you hear on the news or that, oh, they died from cardiopulmonary arrest. So that's just what I said. So nobody died. I mean, the definition of death is cardiac arrest, cardiopulmonary arrest, respiratory failure. So that is not the cause of death. So manner of death. In Tennessee, we have 5 manner of deaths. Certain states like New York, they have 6, which is therapeutic complication, meaning therapeutic misadventures in the hospital. But we only have 5. The origin of the manner of death was for vital statistics, for the state to know that, but it has somehow morphed over the years into legal, has legal implications that were never the origin or implication originally intended for that, for us as medical examiners or forensic pathologists to put down. But now it does have a legal standing, and we do have to keep that in mind. So homicide for us means, for forensic pathologists specifically, means death caused by another, death at the hands of another. So we have nothing to do with first-degree murder, second-degree murder, manslaughter. That absolutely means nothing to us. We don't make those determinations or anything like that. A homicide for us is death at the hands of another. Suicide means someone intentionally took their life. Accident means somebody died unintentionally. And then natural deaths, what they sound like heart attack, cancer, different things. And so when we can't decide between those 4, we have a category called could not be determined. And that rate is very low if the could not be determined. It usually is about 10% of the cases that we fill out the death certificate for. So what a forensic pathologist is not saying who committed the crime or the offense. We're not responsible for any charges or convictions. We're not crime scene analysis experts. We're not ballistics experts. We're not toxicology experts. We're not radiology experts. We're not dental experts. We're not anthropology experts. And we don't say if a standard of care in medicine was violated and that another doctor is at fault. We don't work for police, FBI. We don't conspire in any way to conceal any crime or anything of that nature. Where we should be and have always remained neutral. As we like to say, I go to court and testify. It's not up to me to say if they did it. I don't know if they did it. If they don't do it, I don't even see the outcome of the court proceedings at the end, because I'm just here to state facts. This is what was in the autopsy. This is how they died. And we're not, not infallible, or I spelled that wrong. So I was that get it. So autopsy reports, during the process of the autopsy, we examine and document the outside of the body. And it's pretty detailed and particular. We do hair color, eye color, teeth condition, scars, tattoos, injuries, height, weight, race, sex, and we were obviously given age and we verify that by means that I'll talk about later, identification. Then we examine the inside of the body and document everything. So we look at every organ, we describe it, especially if it has any injuries, we take a weight, and then we do other things if necessary. Like I said before, examine clothing, look at x-rays, and then the culmination of that is an autopsy report. So I write every single day. I produce something in writing every single day. Common question I get asked, and obviously I have questions towards the end. How long does it take to perform an autopsy? Just depends on how difficult or involved the case is. The shortest amount of time is around 30 to 45 minutes. The longest amount of time I spent doing an autopsy is 2 days. So obviously not all day, those 2 days, but business hours, those 2 days. Does it smell? We completely down in personal protective PPE. So we have surgical gowns on, we have N95s, we have face shields, we have gloves. So we don't usually smell anything in particular. I think people imagine that it's like this gory, awful smell. I'm not gonna say it smells like roses and flowers in there, but it smells like a hospital smell to me. So if you've ever been into a hospital, it smells like hospital smell to me. When we have decomposed bodies, they can smell very badly, but they don't happen as often as people think. We usually don't even have a decomposed body every day. They do happen, but they don't, and they smell the worst. How many deceased persons do you get a day? Before the pandemic, we were averaging about 4 to 5 autopsies a day. Now, since the pandemic, it's probably triple that, anywhere between 10 to 15 a day. So the autopsy report contains demographic information, an external description of the body, medical intervention description if it was performed, because some people die at actually the death scenes, but then some people get transported to the hospital and then pronounced dead there, either when they arrive or at some other time, whether it be hours or days later. We do an internal description of the body. We make diagnoses like heart disease, coronary heart disease, obviously if they're gunshot wounds, anything like that. And then we do a summary and conclusion, which basically says this person died under these circumstances. This is what we found at autopsy. These are what the toxicology said, or any other studies. Sometimes we do microbiology culture. Sometimes we do testing like you would get at the doctor's office, like look at your kidney function and different things of that nature. So it'll be something described about what those findings were. And then at the end, we say what the cause and manner of death. Autopsy reports in the state of Tennessee are public record. So anybody can request an autopsy report from our office and they pay the price of printing and they can have it. In states like Florida or New York, they are not public record. So it just depends on the laws in the state. This is a little blurry, sorry, but this is the autopsy report that I pulled off the internet for Michael Jackson. The odontology, so they had a doctor, that dentist that specializes in forensics, come in and look at his teeth, but probably because it's Michael Jackson, and then they did the circumstances, and you can, sorry, it's blurry. It wasn't blurry on my screen, but the first under it says circumstances, and it says external examination, which is what I said, that description of the outside of the body. And then they did the evidence of recent therapy, which was the medical intervention that happened, the tube down his throat and everything like that. This is further his autopsy report that I pulled out the internet. They describe his clothing. Everybody, the autopsy gets what's deemed a Y incision. So basically a Y-shaped incision that encompasses your chest and abdomen. They describe the organs, the neck, the chest and abdominal cavities, the cardiovascular system, and the respiratory system. This is the body diagrams also of Michael Jackson that I pulled off the web. And basically this is a standard body diagram that we use. Everybody's might look a little different. There are a lot of documentation of punctures and scars and different things of that nature that they produce on here and on his head as well. So toxicology testing, everybody gets toxicology collected. Whether it's run, we run about 90% of the toxicology that we collect. The only reason why we don't run is if there's been a long period of time between once the injury or the disease process happened and they die. So we don't do that in those cases. But we collect blood, vitreous fluid, which is the fluid behind your eye or in your eye. We collect urine, we collect samples of liver, and then we don't here have our own toxicology lab, so we send it off to a lab. Other tissue samples are taken if the body has broken down or decomposed so much. We can take liver, as I said before, spleen, we can do muscle. Those are probably the most common other samples that we take. We commonly test for alcohol and the most common drugs of abuse. So cocaine, methamphetamine, opioids, the PCP, just different. And we can only test what we actually know. So other things, there are obviously other compounds that can cause death or cause you to overdose, but we can only test the ones that we actually have knowledge of. So we usually have to have knowledge of something like people can overdose off of from huffing, from duster or different things like that. That's something we would have to know ahead of time in order to order the test to find that out. So identification. So there's scientific identification and non-scientific identification. So non-scientific are visual. So somebody dies in their house or at the hospital, somebody lays their eyes on them and say, yeah, that's my loved one. This is so-and-so, so-and-so. Photograph. We can take a picture of the deceased individual and show it to family members and say, is that your loved one? And they can say yes. And then presumptive, meaning the person was found in their residence alone, nothing seemed to be disturbed, and we found their ID or something. So if their house is not disturbed, their ID there, we say, we're pretty sure that's them. Those are all non-scientific ways that we actually prefer not to do. Photography is probably the least reproducible, or the one we feel least confident about, because there have been examples or times where accidentally they've shown the wrong photograph to a family member and they said, yes, that is my family member. So we really don't like to do non-scientific methods. So scientific methods are fingerprints. We can fingerprint almost everybody with different methods. Even in Arizona, they have in Pima County, they came up with a method because they would find deceased individuals in the desert, and they would be people that came across the border. And so they were having a hard time identifying a lot of people. So they came up with a way to rehydrate the hands of deceased individuals to get fingerprints. So there are all kinds of ways. Almost everybody is fingerprintable. The FBI even has a website and some videos on how to get fingerprints on everybody. We do, after fingerprints, like I said, that gets us most of the identifications that we need. After that is dental comparison. So we must know who we think the person is before we're able to do a dental comparison. And we will get the dental records from the dentist's office. We have a forensic odontologist that we employ, and he will do comparisons. So basically, we can even get a CT, and Sri knows, so CT, they usually take some kind of side photo before they actually do the actual serial images. And so if we have that, he can look at that, look at the teeth and sinus patterns or different things of that nature and make a positive scientific identification. We can do radiographic comparison. So if a person has a heart procedure or CABG or something, they usually put what we call sternal wires in their chest if they look a certain way, if their spine is curved a certain way or has different bony identification methods on them. If they have orthopedic hardware like a hip replacement or a rod in their leg or their arm, we can identify that way as well. And we as pathologists do that sometimes with the help of a radiologist on those different cases. And so that gets us identifying people probably about 99% of the time. Those three: fingerprints, dental comparisons, radiographs. So only rarely do we have to do DNA. It's very expensive. Not as expensive as it used to be, but it ranges somewhere $1,200 or something of that nature. We like to use forensically. We like to use parents first, followed by siblings, then followed by children. That gives us the most probability of making a positive identification. And we can use anything for DNA. It doesn't have to be blood, any organs, bones, teeth, anything, we can use that. The only, I guess, difficulty that comes in with DNA are on identical twins. So identical twins have pretty much the same DNA, except there are a few parts of their DNA that are different, and they're very few. So you would have to sequence their whole DNA profile to say the difference between identical twins. And most of them don't have a DNA profile that elaborate on file. So there have been cases where identical twins have been involved in a fire. And what we have to do there is basically say DNA is good. We compare it to the family members, but we can't tell which one was which one. I think one time we ended up saying because this one slept in this bed and the other one slept in the other bed, and that's who it was. So we do not release any remains until they have been positively identified. And another part of misnomer out there is that our autopsy morgue is overrun with bodies, or that we have literally, like I said, I've worked here for 9.5 years. We have 3 unidentified people that have been there since I can, well, I should say since I started, but during my process of working there. So literally 3 people. And like I said, most of the people come to our office, they get identified. Evidence collected by forensic pathologists. So we collect evidence. We do not test it. That's another, we're not at the crime scene or on the autopsy collecting and testing evidence. Evidence we routinely collect is DNA samples. Everybody that comes to our office gets a DNA sample. Fingerprints, fingernail clippings. We do those for all suspicious deaths and all homicides. Hair, which is the same thing, all suspicious deaths, all homicides. Bullets, which is why we do x-rays to see if there are any bullets that we need to retrieve, most of the time with homicides, gunshot wound homicides. A rape kit that has to be, if we see something suspicious, we'll do it on our own, but most of the time it's asked by the investigating agency, and it's up to them whether they test it or not. We just, once again, we collect, we don't test. Gunshot residue testing. That's another thing that, oh, everybody's the rage. Oh, get a GSR, they'll tell you all this information. So GSR kits and testing is virtually useless. If somebody dies from gunshot wounds, what comes out in the residue kit test is antimony, lead, barium, and selenium. So it comes out the end of the gun. Obviously, it's not really identifiable, and it is deposited on the person that shot the gun as well as the deceased or the person that's receiving the gunshot wound. So if a person has been in the room when a gun is fired, whether it was fired at them or they fired it, gunshot residue testing is going to be positive. So it's absolutely completely useless. So occasionally, maybe if it was negative, it would tell you something, but that's not even really reliable, because if they wash their hands, or if even at the time of autopsy, if we wash the hands thoroughly, we can wash it off. We collect clothing and personal effects and medications that are either at the scene or on the deceased person when we find them, or do the autopsy, and drugs that we found on or in the body. So evidence collected by police, they do blood or DNA that they find at the crime scene. They can even get DNA from cigarettes, bottles, anything they deem necessary. They collect a gun if it was at the scene, any bullets that they find at the scene, any casings. So they do everything at the scene. The fingerprints, if they see any fingerprints other than on the body, they'll take them around the whatever, if it was a house or outdoors, a car or whatever, they'll take fingerprints there. Any containers, if the body was found in a container, anything that they deem necessary as a container to collect. Electronic devices, so laptops, phones, they almost get everybody's phone. Video evidence, so a lot of people have cameras inside their house, outside their house. They take recordings on their electronic devices. Any diagrams, they actually make diagrams of the scene. They take their own pictures. We take our pictures, but they take their own pictures, which are usually more numerous and elaborate. They do a scene reconstruction. They actually do video scene reconstruction, as well as a paper scene reconstruction. Any objects that they car pieces, paint chips, any parts of the home, like during a fire, any drugs at the scene, any notes in the case of suicide, if they left a suicide note or anything particular. They will do alternative light source on the body. Basically, they come often to the medical examiner's office. They have a dark light scenes, and they'll look for anything they see particular, any bruising, any fingerprints that they see, or impressions or anything of that nature. And then they also collect the evidence that we collect at the medical examiner's office. So they come and pick it up.
Not good.
Did I go on, or
Lynn, can you mute that person?
Yeah, Pat, I
I'm-
think you're muted. You need to mute, Pat.
Yeah, can you like do an admin mute?
Well, right now the screen is in.
Oh, let me see if I can do it. Okay.
That'll work.
Yeah.
You said it's Pat?
Yes.
No, it just gives a number actually. 510912.
What went away now? So let's see.
That's Pat, I think. Go back. I think there.
Hold on.
Are you still there?
My computer mouse is
Hello?
not acting right.
Still there? Oh,
Yeah, it lost the connection.
so it froze up there for a minute.
Anyway, I'll keep going. Sorry. Evidence testing is actually done at the.
Oh. Well, I'm so,
Here we go. Done at the Tennessee Bureau of Investigation. They used to be located in Memphis,
yeah.
but now they're located in Jackson, Tennessee.
There.
Erica, we lost your screen.
No, there.
Yeah. There, thank you. Can't you, Lynn, can you mute everybody except Erica?
I'm trying to now. That's why I took your screen back, Eric.
Oh, okay, okay,
Hold
thanks.
on just a minute.
You should be able, Erica, to go in and re-show your screen now. I've muted everyone except
Okay,
Jackie.
thanks. Okay, are we good?
You're good.
All right, done at the Tennessee, the evidence testing done by TBI is what we call them. And they used to be in Memphis, but they recently moved to Jackson, Tennessee. I don't know why, because most of the business comes from Memphis, but I think it has something to do with funding and politics. They do ballistic testing, so actually test firing. So what happens is the bullets that we find, if we find any, are taken there. They will test fire the gun and the ammunition that they think was used. Every time you fire a gun, as probably most people know, it has specific characteristics that it leaves on the gun, in particular the jacket or the outside of the gun. So they compare that, the one they test fire, with what was collected at autopsy, and they say, yes, this gun fired that bullet. And so that's how they do the comparison or positive ballistics testing. They do DNA testing there, fingerprint analysis. They have their own toxicology if they want to do that as well. They have chemistry where they do actually drug analysis of stuff that is found at the scene. There's they have crime scene has what they do test analysis, or so they can have a kid that says, oh, we think this is fentanyl or we think this is heroin, but actually to have it positively identified, it has to undergo a chemistry specialized testing with specialized equipment. Microanalysis, fire investigation, GSR kit are analyzed there, impressions. TBI does computer and electronic analysis, handwriting analysis, and audio analysis. I one time had them analyze a video to if they could tell me how many times they could hear a gunshot fired. So turnaround time. So for fingerprints and for identification, it's usually a couple hours. So basically, we upload the fingerprints to either the FBI website or local. They run them over to our local jail, and they do the comparison, and that gets a computer comparison. That'll be done in hours, and that's how we get once again a positive identification. If it's fingerprints at the scene by TBI, it'll take a longer period of time. Almost everybody has fingerprints on file. Even me as a doctor, for my medical license, I had to submit fingerprints. So even when I worked in the hospital, if I was going to be around anything that gave off a radio frequency, I had to be fingerprinted for that as well. So most people these days have fingerprints on file. Toxicology takes anywhere from 3 weeks to 12 weeks. Once again, just depends on how elaborate the testing is and what they find. DNA for identification takes 2 to 3 weeks. Autopsy report takes 4 to 12 weeks. And it's just one, because we do depend on toxicology a lot of times. And then if it's more elaborate and we have, like I said, somebody has a lot of gunshot wounds, or if it's a fire, you're waiting on the fire investigation, it can take a longer period of time, sometimes up to 12 months to actually have the report finished. Ballistics, DNA, fire, things that TBI has analyzed. I know the last time I checked, their turnaround time was somewhere 42 weeks to 50 weeks, because they're understaffed and they're overwhelmed as well. So what we help police with, what we can help police with, cause and manner of death. So it's most of the time they have an idea of what, obviously they've seen a gunshot wound, homicide, they're pretty aware of that. But we do call them and tell them how many gunshot wounds we find, what the major organs that were injured. We'll tell them the range of fire, meaning if it was a close range or distant range, and any unusual things that we find that might help them with their investigation. When we usually do that, that's another misnomer there on TV. They say, "Oh, we got the autopsy reports the next day." That what they got was a preliminary phone call from a doctor saying this is what we found. The autopsy report, no matter how good a forensic pathologist is, they're not usually giving it to them the next day. We can give them clues at the crime scene, whether they have overlooked something. One time here, there were tire tracks leading to what they thought was a regular motor vehicle accident, and it actually was somebody that was purposely run over with a car. So we can say, hey, can you get this other homicide team to come out? This is not a routine thing. We can provide them autopsy findings to corroborate or refute theories of evidence. So if sometimes they like to, or they have cases where they think there's a justified homicide. Basically, somebody's in threat of their life and therefore they shoot them or do some other mechanism to kill them in order to save their own life. But most of the time, those cases, they'll describe the findings and they'll say, oh, they were tussling over the gun and, then, he got shot in the chest. And then if you do the autopsy and he has 7 gunshot wounds to the back, that kind of just throws that theory out of the water. We give them evidence collection, as I said as well. The range of fire, like I said, that helps them to know if whatever theory that they're working on or they've been told through witness and witness statement is actually true and credible. We help them with trace evidence, same thing with the fingernails, any hair fibers or anything we find, and toxicology trends, because we get the toxicology results and we can say, hey, this is a new drug that's trending here. You might want to, look forward or whatever. So another thing we look for at autopsy besides the injuries, just in general, we can look for patterns on the skin and compare them. So we'll just say it looks like a pattern of something. We could just say this, because we have what's called abrasion or scraping of the skin, and we have contusion or bruising of the skin, but sometimes they can look like things. So if teeth impressions can look like things, fingernails can look like things. Baseball bats give a particular impression on the skin. Knife patterns can give a particular impression on the skin. Footprints, shoe prints, car pieces or parts or tire prints can look like something on the skin. So this is the only slide next that I actually have of a deceased arm. It's just the arm, so nothing gory. So if you need to look away, feel free. So this is actually somebody's left arm. And like I said, at the time of autopsy, all we would have said is that is a pattern that looks like something. We won't know what it is. Well, that's what we'll tell the police. It looks like something. I'm not sure what it is. Like, I'll send you a picture and you'll see whether you have anything at the scene or if you need to go back at the scene. And then this is actually a shoe print that they found that was on the deceased arm, and they reimposed it through pictures. So we do employ anthropologists because sometimes people are decomposed to the point where they're mostly bone. We can determine if there are any injuries. Our anthropologist is very good, and he can look at the bones to see if there are any gunshot wounds, any fractures. He can tell you the direction of them, and that if we see injuries, that is enough to say the cause of it. So poisonings. If I've heard this story once, I've heard it twice. Oh, my loved one or someone said, if anything happened to me, she did it, or he did it, or they weren't feeling well after it, and she gave them food every day and it just never felt well. And so we have heard that a lot. I have yet in 9.5 years to diagnose poisoning. It's just a rare occurrence. Either people are doing it so well that we can't find it, or it's just not occurring, which is what I think. It's just not occurring. There are 80 million compounds in the world. So we would have to know specifically what they were supposedly poisoning with. And there are common things that we can look for, which I'll say on the next slide. And people often have non-specific symptoms, metallic taste in the mouth. If you have a bad sinus infection or basically have taken a medication, that can produce a metallic taste in your mouth. Headaches, muscle cramps, dizziness, nausea, vomiting, diarrhea. These are all like non-specific symptoms that you can have in a myriad of diseases. So cyanide, it produces what's called a bitter almond smell. Only certain people can smell it. So I was tested when I was in fellowship. I cannot smell cyanide. So if it's at the autopsy, I would not be able to smell it. It's supposed to produce, when you expose, some nausea or vomiting, but I've not been in the autopsy suite and felt any nausea or vomiting or headache out of proportion. So arsenic, lead, copper, mercurium, barium, thallium, mercury, nickel, selenium, and antimony. So we have a lead panel or heavy metal panel that we can test for. Once again, if we think it's a poison, it has to be known before the autopsy because there's special tubing and testing that has to be done. And we can test for the common ones. We can pull hair for the common ones as well, but anything else, we would have to know specifically what that substance that they think they poisoned them with. What are the most kind of difficult cases? And that's difficult cases because they can bring basically scrutiny or unpleasant family members because of the results of the findings, or even legal ramifications because of. So suicides are actually our hardest cases because families sometimes have a hard time accepting. I've heard they're religious, they were looking forward to life. This is something they would never do. Somebody is staged. It is something that, for me, that has been my most difficult case. I actually had dealt with a family for 5 years over suicide and ended up going to 2 depositions over it. In Memphis, we almost always autopsy suicides, but that's not standard in forensics. Sometimes people don't always autopsy suicide cases. And then the scene investigation can be lacking because sometimes the police will think that, oh, it's a suicide, I don't have to do as much or as the routine. And sometimes they can do minimum, and that can come back on the back end and backfire. Pediatric homicides, once again, they don't happen that often, but a lot of the pediatric homicides have head injuries, so bleeding around the brain, swelling of the brain, and bleeding of the eyes. What's called, I guess they used to call it SIDS, but it's really not SIDS. And so it's always a lot of time difficult because there'll be whoever the caregiver is at the time will say they fell down some steps, they fell. And so all you have is this head finding. And so you have to take everything into perspective, including the scene investigation, the circumstances, any other history of the family or anything to say whether it was actually credible that they fell or was it inflicted trauma. And police involved this just because obviously they come with a certain amount of scrutiny and basically conspiracy theories fly right off the top. So I've addressed some misconceptions, but I'll try to do a little bit more. So time of death, that's another thing that they portray on the TV, is that we know exactly the time that they died. Now, sometimes that is true. If you go to the hospital and your heart starts beating, they know exactly when it stops beating, and your respiration cease, they know exactly when that is. A lot of the time at the crime scenes, people are found deceased or found after they haven't been heard of, or someone heard gunshot. So the time of death usually is about the time, but not exactly the time, especially if somebody's been found at their home, especially if they're decomposing. The time of death for those cases of people that are found at home and haven't been heard from is the last, what we try to do is see the last time that they're heard from. But what we often use is they call medical personnel or paramedics to the scene. They put a heart monitor on them, leads, and then they pronounce a time of death, which is probably usually not the time they actually died. So that's a misconception. So everyone that comes to the medical exam, and I should go back to the time of death, we have no scientific way at this time to actually say exactly when the time of death is. They are working on one, but it still hasn't been proven yet. So not everyone that comes to the medical examiner's office gets an autopsy. Some people do get an autopsy, but some people get what we call an external examination, where we look at the outside of the body to determine if they have any injuries, and if they don't, and they have well-documented medical history, then we just do what we call external examination and draw toxicology, and then we perform the death, make out the death certificate based on the medical records and the toxicology finding. That most cases we examine or do an autopsy on are homicides. Actually, it's the minority of cases. Most cases these days are natural deaths and accidents. but the news portrays it so often, so you think that's pretty much all we do. Gun-related deaths. There is the thing that you'll hear the police say often, most often, murder and homicide. So once again, homicides for us are death at the hands of another. Murder for the police is death at the hands of another that was not justifiable. So police don't put justifiable homicides in their murder statistics. So their statistics will always be different than our statistics. And then accidental gunshot related deaths. A lot of people think of the Russian roulettes or different things, and police will classify those as accidental death, or the gun went off. They didn't mean to shoot the gun or shoot it. We will actually put, for Russian roulettes in our office, and it differs amongst the different jurisdictional areas of the country. Russian roulettes for us are suicide, because we feel like, especially if you're a gun enthusiast or old enough of age, you know, if you put a gun to your head with a bullet in there, that is a high probability that you are going to shoot yourself. And then accidental firings do happen, where the person didn't think the gun was loaded and they shot it, but most of the time they know it's loaded and they're shooting it towards somebody. And so for us, that is a homicide. We already talked about the gunshot residue testing not being useful. A lot of criminals, unfortunately, think that if a body is burned, it can't be identified, or we won't know if they've been shot or stabbed or strangled, which is not true as well. We have x-rays, they can identify bullets. We have an anthropologist, like I said, that can identify bony injuries. If the body burns on the outside, but the fire has to be so hot for it to consume the whole body. That's the other thing, like crematorium hot, which a regular fire never gets. So the body will be burned on the outside, but most of the organs on the inside will be regular. That all hangings have a broken neck. Most of the hangings do not have a broken neck. They actually have no injuries on the outside or the inside of the body on the neck. So no neck hemorrhage, no fractured neck. They can sometimes, what we have called a ligature furrow or a Nus's mark on the outside. But if you take that away very quickly, that will go away as well. Delayed deaths sometimes trip up other physicians. So if somebody got shot at any particular point and they had complications or consequences of that gunshot wound. So if you get shot and you become paralyzed, or you get shot and you're on a ventilator, or you get blunt trauma and you end up in a nursing home. If there are any complications from that gunshot wound, no matter how long ago it happened, that is a medical examiner's case, and that if you got shot by another person, that's a homicide, no matter how long the length of time is. And falls often don't get reported to our office. Like if elderly people that fall a lot and they fall and they get hemorrhage on their around their brain, or they break their hip or whatever, that is a medical examiner's case. That's not a natural death, that's an accidental death. So a lot of those don't get reported to our office like they should. And then other misconception, like I said, is that we work for police. And then lastly, I'll just tell you my personal story of that I did true investigation was, and the meaning or purpose of the story is to say that forensics is not in a box. We work with police, we work with criminalistics, we work with families, so it's a whole compilation. It's called a crime scene investigation for a reason, because it's a lot of investigating information, toxicology, microscopy, and everything that goes into determining the cause and manner of death. So when I was in fellowship in Miami, if you've ever been to Miami, there's this Miami Beach, there's this outdoor mall called Lincoln Road. And so I was parked my car in a parking lot close to Lincoln Road, went into a store and came out and saw that there was a note on my car that said, somebody hit your car. Here is the license plate number. I can tell which state it was from, but this is the color. And they something on the car looked very particular, like an upside down V. So call the police, they come, they do a police report. He says, I'll be in contact with you a couple days. So I had access to a person that has access to national databases with license plate number. So I had them in the meantime, look up the license plate number. Based on the color, I Googled the colors of different states of this particular color, and it came up with like 3 states for the color. And then, so we looked that up. So we've narrowed down based on the license plate number, only 2 states came up, and one of them was with the color of the actual description from the person that left the note, which was like blue and white, I think, or something like that. And then we saw that based on that car was actually an Acura, which was his upside down V. I didn't understand at the time description. And that they were out of New York, but then they had a local Miami Beach number. So have that information, have that in my back pocket. So the police officer calls me about 3 days later and says, hey, we've been looking into it, but they're like 50 states and they all have that, 50 states, they could have that same license plate number. So there's no way that we can, figure that out. And so I actually says, hey, well, I've been doing some digging myself. And based on the description for the license plate and the description of upside down V, there's an Acura that's registered to here or whatever. Here's the local address. So he goes over there. He looks at the person's car. They say that they haven't been in an accident or anything of that nature. He looks at it and he sees the paint chips from my car on that person's car, although they said they hadn't been in an accident. And the valet said that the car had that same paint chips for like years or something. So he takes a piece of that paint chips and then he comes and he literally compares it to my car. He gets that person's car information, insurance information, and then basically based on his findings, ended up obviously getting my car repaired based on his. But I just said that to say it takes a compilation of work, and sometimes police do the work, sometimes we do the work, sometimes family does the work, but the whole primary goal is to get the actual cause and manner of death and justice or whatever, findings for the family and the community. So I'll take questions, and that's it.
Okay, everybody can unmute, stay muted. But if you have a question, let's hear it. I can't see anything but Erica's screen right now.
Let me see, I'm stop sharing it. Hold on.
Oh, okay, there.
I have
Thank you.
questions.
All right, Victoria.
I have 2. So I know that a lot of times when you can't find a family member, you have police do a well visit. If they find them deceased, they call an EMS because they both come, correct? EMS and the police will come.
Yes.
The very common question is, did they suffer? And I've heard the police say, no, we can tell we've come to this sort of, heart attack, whatever. Before they didn't suffer, it was instantaneous. Can they really tell that, or is that just to comfort the family?
I think that's to comfort the family, because now if there's a injury of some sort, I've been asked that with an injury, or did they suffer or whatever. So if there's an injury there and we based on the statements from people around when they heard the injury, then you can say that, oh yeah, yes or no, they didn't, or something. Obviously, sometimes when people get into traffic accidents, their body, sometimes the car will catch on fire and their body will burn. So that's a frequent question I get with those. But if they had traumatic injuries and died from the car accident and then the car caught on fire and we have a way of proving that they were dead before the fire actually started, then I can say then, no, they didn't suffer, they died instantaneously. But from
Right.
heart attacks, you can't say, especially like you said, if they're just found in the house, nobody really knows what went on.
What
If they
happened.
fingered or they went immediately or whatever.
Right. So then if a family wants to do an exhumation for legal purposes, they feel maybe physicians had not done everything they could do, how easy, at an exhumation, if it's been a couple years, are you able to determine that there might have been some medical problems? Well, that maybe the physicians could have done something more, didn't do everything they could have.
So
When-
most exhumations are for suspicious or criminal deaths.
Okay,
But we're not the people that can order an exhumation. The DA's office, but we can support it or not support it. So the chief medical examiner can write a letter in supporting of that. So when it's for something suspicious, the ones that I've been involved in haven't panned out to be suspicious after that. But I haven't been involved in any exhumation because of medical misadventure or anything like that. Most of the time, families have suspicions of that early on, and even if we won't do an autopsy, they'll get a private autopsy by another.
right. I'm talking about like if there's a medical malpractice case and
Yes.
and the person's already been buried,
Right.
would there have to be, I guess, as an exhumation? Or would it be able to determine anything at that point in time for the malpractice case?
It would probably be best if they haven't had if they already had an autopsy, then
Right.
you're good.
But if they didn't,
If they didn't, an exhumation would be best, but once again, that would be the DA making.
right. But could you still determine malpractice?
Yes.
Or, okay,
Yes.
all right.
Okay. Anyone else have a question? I have one, if you don't. All right, my question is about, you said you rarely get poisons, but if a doctor said to you, I'm sending the body of this fellow over, he was an auto mechanic, but I've had 2 people involved with garages, 3 people involved with garages show up in the hospital with the same symptoms, and this one died. We think it might be something that was in the garage. Would you then have enough clues from that to be able to say, geez, I better test for antifreeze or for something?
Right, we could definitely, but the investigation for the police would be the best way to get us more information. So CO, carbon monoxide, we can definitely test for that. Antifreeze can definitely be tested for. Like I said, the heavy metals can be tested for, but anything like
okay.
more. Go ahead.
That's what I was going to ask you. Your heavy metal test, would that turn up like antifreeze poisoning?
No, we have a blood test for antifreeze, and we can microscopically looking at the kidneys. There are crystals that we can see for that. Underneath for antifreeze.
Okay, that's what I was looking for.
So
So
would there be
actually,
any physical signs of poison, like say antifreeze, that would clue you in immediately? You know, like because some things make your fingers turn or
So-
skin get pallor or something.
Yes. So lead will leave little lines on your fingernails, and so sometimes we can look for that. Another one called methemoglobin or sulfahemoglobin can make your blood look chocolate or deep dark brown. So that's another clue for that. Like I said, cyanide, people that can smell it, they'll get a smell of bitter almond smell, or like I said, we're supposed to sometimes feel really sick in the autopsy suite doing that. But the other ones, they're really not any specific signs.
oh, but you said with antifreeze, you can find crystals in the kidney.
Yes, and you have to, but that would require you actually looking underneath the microscope at the kidneys as well.
Okay. Does anybody else have any questions?
The feeling I'm getting then is on poisonings, you would have to have some suspicion of a particular poison before you'd really catch it. Okay.
That's correct.
Okay. That's what I wanted to know. Angeline, you have a question?
Just a quick question. Are you able to make your slides available to us?
Oh yeah, I can do that. I can send them.
Okay.
Sure.
That'd be awesome.
Perfect. If you would send them to Lynn, he'll put them up on our website for members only. Thank you very much. That was a terrific presentation. And I started to make notes and I realized that it was not going to keep up. And so I was going to ask if you would put that on our website so we can go back.
Yeah,
and
no
refer.
problem. No
I
problem.
have one final question.
Sure.
Is Mississippi a corner state or is it a meek state?
So Mississippi is a coroner state. They only have one place that they do autopsies. That's in Jackson, Mississippi. They were severely understaffed the last time I checked. So it takes Mississippi a long time to produce autopsy reports and therefore get court proceedings and into the investigations. So
I have one more question.
Mhm.
Is there a place you can go to look and see what states have coroners and what states have medical examiners?
You
Like,
can probably just Google like whatever
Okay.
state you're particularly interested. So Maryland is completely medical examiners. Virginia is completely medical examiners.
Kentucky.
Kentucky is coroner. I think that's mixed. I think it's mixed.
I'll look it up. Okay.
Yeah, yeah.
All right. Anybody else have a question? So we can let Erica go about her Saturday. And I personally have got a ton out of this. I got so much, I got overwhelmed. And
I'm glad.
especially, it's going to be so helpful in story that I'm currently writing, not to mention a novel. So thank you very, very much.
You're welcome. Bye-bye.
Thank
You
you
guys have a
very
good day. Bye-bye.
All righty.
Thank you, Erica. Thank you very much.